Good morning, I'm Vic Senese, and this is UroNurse News. Today we're diving into one of the hottest debates in urology, single port versus multiport robotic surgery. This topic sparked lively discussion at this year's American Urologic Association's annual meeting, and it's a question many surgeons are asking: which approach is best for our patients? Robotic-assisted surgery has transformed urology for over 2 decades, with multiport systems becoming the gold standard for procedures like prostatectomy and partial nephrectomy. But in recent years, the single-port robotic platform has entered the scene, promising smaller incisions, faster recovery, and less invasiveness. However, the evidence is still developing and not everyone is convinced. Dr. David Lee, professor of urology at UC Irvine Health, pointed out that multi-port platforms have a proven track record. Hard to argue with that, while single-port surgery is still relatively new. He cautions that single-port systems may have limitations in instrument strength, range of motion, and mobility. That's what robots are known for. But he does acknowledge that single-port surgery shines in certain cases, particularly when instruments can be placed very close to the target organ, bypassing challenging anatomy. On the other side, Dr. Simone Crivellaro of the University of Illinois in Chicago is a strong advocate for single-port surgery. He highlights its efficiency in small spaces and sees it as an excellent tool for carefully selected patients. But even he agrees that multi-port surgery is still valuable, especially when more traction and force are required, like in cases with very large prostates or kidney tumors. Nice thing is that we have more than one tool in our toolbox, so you may as well use them. Both sides agree on one thing: training is critical. Dr. Lee emphasizes that surgeons must complete required training, perform case observations, and work with proctors before attempting independent cases. Progressing with 1 or 2 favorable cases per week helps overcome the learning curve safely. Dr. Ricardo Ortino of Rush University, where I am a graduate, said that after 2 years, 80% of his cases are now single port. He says the transition is not easy, but ultimately provides patients a less invasive surgical experience. Importantly, he stresses the need for consistent case volume early on to master the platform. Dr. Igor Sorokin from UT Southwestern reminds us that this is also about patient preferences. He notes that single-port surgery can be particularly beneficial for those patients with hostile abdomens, those with significant prior surgeries or on peritoneal dialysis, because it can avoid entering the peritoneal cavity altogether. Meanwhile, Dr. Ronnie Abaza from Central Ohio Urology Group has a different take. After performing about 200 single-port surgeries, he saw no significant benefit over multi-port and has stopped offering it. He argues that claims of faster recovery and shorter hospital stay may not be supported by real-world data. That's going to be key to look at the evidence. So where does this leave us? The consensus seems to be that both single-port and multi-port systems have a place in modern urology. Evidence from prospective trials and real-world studies will ultimately guide which approach becomes standard for specific procedures. For now, patient selection, surgeon experience, and institutional resources remain key factors in deciding between these two platforms. One thing is certain: as technology continues to evolve, robotic surgery will keep pushing the boundaries of what is possible in urologic care. Join us tonight at 7 p.m. on drjeffsextalk.com. What does it mean to return to our authentic selves? And how can that deepen our capacity for love and connection? In this episode, Dr. Jeff is joined by psychiatrist Dr. Arnab Datta for a powerful conversation about how reconnecting with who we truly are can transform our relationship. Power naps can boost your brain, but too many naps can be a red flag. Find out what doctors really want you to know about napping in this update tomorrow on UroNurse News. Thanks for watching us. If you found this briefing helpful, don't forget to like, share, and subscribe to my channel for more updates on cutting-edge urology topics.
UroNurse News, the stories you need. Healthcare and science at top speed. From clinic to lab, we bring it to you. UroNurse News, the updates are true.